Welcome. My name is Dr. Brian Lesage, and we are here at the Beverly Hills Institute of Dental Aesthetics, which is my private practice. And we'll be demonstrating a posterior composite on tooth number 13. So a DO composite using Herculite's Ultra, a composite new material, new nano-filled, nano-loaded, really micro-hybrid material. So many of you, I'm sure, have experienced Herculite in the past, and I have really a 20-plus year experience of using Herculite. And so now we're venturing into Herculite Ultra, which should be hopefully a better product than even Herculite, which is hard for me to say because I was so thrilled with Herculite. So with that, we will start by putting in the rubber dam on the patient. And as I said, we'll be doing tooth number 13, DO. If you've heard me speak before on composites, I've always told you that you would see me 100% of the time putting a rubber dam on, and I always encourage all audiences to use a rubber dam whenever you're doing any posterior composite, any adhesive dentistry work. Certainly best to use a rubber dam. So as you can see, it's pretty well isolated there, and so we'll start doing the preparation on tooth number 13, a DO. So there you can see the very conservative preparation that we've done. Again, just somewhat of a box form just to get access to the decay deep in there. And hopefully you can see I love to have an enamel periphery. So hopefully you can maybe see in the picture, even though it's kind of hard to videotape these in the mouth, that I have an enamel on the gingival floor, and that's the ideal scenario if I can have enamel on the gingival floor. Okay. So now I'm going to attempt to place a sectional matrix here, and that one worked out pretty well. You saw that slide in there pretty easily. I thought I was going to have to separate the tooth with a wedge first, and that's sometimes what you'll need to do in these very conservative restorations that we do today. So it's just a sectional matrix, and I just use a wizard wedge. There are a lot of wedge systems out there. You pick the wedge system you like, but certainly today you need to be using a sectional matrix system of some type. This happens to be Paladent's system. Tafelmeyers don't work well for these restorations because gives you a very flat contact, and the contact is usually up close to the marginal ridge. You can see if you could see that, I call it wedging with authority. So I really, really push, and I usually warn the patient, Matthew, I'm going to push even a little harder. So I just take the back end of my college pliers and I really, really push. And so I'm trying to get a little micro separation of these teeth. So you can see the band is, I get asked a lot of times, do I use the biting ring? And no, I do not on these restorations. Even though if you're just starting out, you may want to use the biting ring because it probably will help you just a little bit not to get as much flash and such on these restorations. So we've got it, as you can see, we have it very well isolated. There's no blood, there's no saliva, and now we have the matrix on. Yeah, we need the smaller brush. And so sometimes these normal micro brushes aren't really adequate enough, so you need to go to a real micro brush here to get inside these preps. Sometimes I'll even use an explorer to get down into the preparations because these preparations can get that small. So ideally I'd love to run the etchant around the enamel first and then put it onto the dentin of the tooth. As you all know, we don't really want to over etch the dentin. We'd only want to etch the dentin for 15 seconds max. So we've rinsed really well. Again, you can see we still have really such a nicely isolated feel, very easy, clean feel to work in. And so we've etched the dentin, maximum of 15 seconds. Now I'm using a OptiBond Solo Plus, a very nice total etch, one bottled system. So total etch, as you saw me do, one bottled system. And this I use for most all of my direct restorations. Is I use the Optibond Solo Plus. So they've just switched to a smaller microbrush because they know this is a little smaller. But unidose vials, certainly nice, no patient cross-contamination. You know, keep them sealed though when you use these, especially if you're doing quadrant dentistry, because the solvent in it will evaporate. So you do want to make sure that once you've used it, that you have your assistant reseal it, put the cover back on basically. And so you can see that I'm agitating it though. I'm not just putting it in there, I'm kind of agitating it. That's really the best way to use these primers, is to agitate them. Some people say rub, scrub, call it whatever you want. Agitation is probably the best word. And you saw I used 3 coats, if you will. You almost can't overdo that, but I'm not going to tell you, you know, 3 is probably more than enough, certainly. But nothing wrong with doing that for a good solid 30 seconds. And then you need to very adequately blow the solvent off this. So suction way in the back. So I like to turn that off. So I really like to blow until nothing wiggles. And now you can see I'm using a fantastic LED light, the Demi light here. And so I really do enjoy this light. This light because it's very lightweight, very portable. No, but you can see it's, you know, it is really very lightweight, very ergonomic. Sits in your hand very nicely. You know, have nice sleeves on it, keep it nice and clean, sterile from patient to patient. Stays well charged, even though it has a very small base charger that we have too. So now the assistant has placed out a small increment of the Herculite Ultra here, and so you can see this is a pretty conservative preparation. So I'll probably use 2 increments on this one. And so what I hope you can see in the video, that just that nice convenience form, how easily that it just gets placed into the restoration. It's not sticking to the instrument, so it really is quite easy to place. For those that have used Herculite, you know that it's a little bit stiffer material. This is a little creamier, probably, and certainly flows a little better, so probably easier to adapt to the preparation walls. You had to work the Herculite a little bit more than this. This almost has an affinity for the walls of your preparation. So it is probably very difficult on the video to, especially because we have the orange protective light on here, to be able to see how well this does blend. We will see it afterwards. So I like to, you know, my personal technique is to bring it to the material in a small convenience form, roughly what I need with some type of IPC type carving instrument, and then using a very small condenser. And like I said, this material really is nice and creamy, and it does flow really, you know, flows, maybe not the exact word, but moves very nicely. You can sculpt it exactly how you want it very easily. Whereas those that are used to working with Herculite, you have to work with the Herculite a little bit to get it exactly where you want it. When the assistant wipes my instrument, that is just a clean instrument. There's no alcohol or anything on that. You know what I like to do is just fill the buccal, I'm filling the lingual half of this box. And you can see that the material really, it just blends very, very nicely. You know, most of you would call that like a very nice chameleon effect, really, to the material, as the material blends in with the natural dentition quite nicely for us. Okay, go ahead and light cure that. Okay. So really a 5-second cure. Actually, I prefer at least a 10-second cure on these, but since we're deep in the box and it's a small prep, I'm definitely going to go 20 seconds actually from the occlusal, and I'm also going to set it in, from the lingual. So if you only have one shade that you're using and one shade that you're capable of using, getting the effect that you're looking for, that's certainly going to probably save you a little bit of time, but in particular will probably save you some money because you're not wasting two different shades of material. So I'm just I wouldn't condensing this material in. As you can see, I hope you can see someone in the video that it's rather creamy, and but it doesn't really slump, even though it's really hard to tell if a material slumps in a posterior composite. I believe we'll have a video on an anterior composite, though you'll be able to see, and so you'll be able to see that it does stay pretty much where you put it, which is really one of the qualities that I find to be very important, that I can place the material, goes where I want it in an easy, convenient way, and stays there. It doesn't slump on us. So you can see, though, that I keep working this because I don't want to have any voids. So I might work this composite just a little bit more than you're used to, but I really do want to make sure this is well placed and that all the margins are closed, obviously, and that there's no voids in here, so we have good strength in our posterior composite restorations. This is a healthy young patient, so he's got very little, good news is he's got very little tints or stains in his teeth, and so nice healthy white enamel. Okay, go ahead and make sure of that. So I happen to just hold the matrix in place a lot of times instead of using the biotine ring, let's say, with this system. And just hold it there until it first starts to set the cure, and then I don't need to hold it anymore. And in fact, it's almost advantageous to peel the matrix away at that point so the light can work its way around to the buccal. Now we'll set that from the buccal, if you would, please, Gracie. So now we'll just set it from the buccal just like we did on the lingual increment to the box, and then really in 2 increments. Gracie, Gracie, please. So with just 2 really, pretty easy increments, we have this class 2 filled. And we'll have a little bit of flash here on this, so we'll need to do a little bit of trimming, but not much. So I'll take out the matrix here. And what I want to do is have this matrix come out with some pressure, and you can see I'm fighting to get it out a little bit, which is exactly what I'm looking for, because that means that I have a nice contact, and that's really what I'm looking for here. So if you look in the mirror there, you can see there's not a whole bunch of work I need to do. I've tried to create a little bit of anatomy, and so I've learned over the years to become really an additive type composite placer. I mean, I put the right amount of material in, I add the material, and not have to resculpt or recontour a lot with finishing burrs here at the back end. Turn that off if you're not in the mouth, okay? Gracie? Yeah, turn it off if you're not in the mouth. Mm-hmm. So I like to use this red stripe bullet-shaped diamond from Brasseler. It's a 247F009, if anyone cares. That's actually my favorite burr. It's a bullet-shaped red striped diamond to just kind of get preliminary anatomy. Now I'm going to like a ET composite, Brasseler ET composite finishing burr here. And just sculpting a little bit and just making sure the margins are really well sealed. There's no flashing. Matthew, how are you doing? Let me come over here, Gracie. Okay, see a piece of floss. So hope you can see the very little finishing involved there really with this. So, you know, a material that you can sculpt and place the way you like to. You could hear the nice contact there that exists. So you certainly have a good interproximal contact. I know some dentists struggle with interproximal contacts, and it's really just, I think if you use a sectional matrix and I say you wedge it with authority, you can probably pull these off quite nicely. So let's see if you can see in the mirror here. So there's the restoration. You can see really, you know, pretty simple prep, nothing too fancy really there, just removing the decay, getting a nice sectional matrix in there with good isolation and good adaptation of the matrix with a nice wedge, and then, you know, using this new material, this Herculite Ultra, which, as I said, is very creamy, nice creamy consistency to it, so easy to really place and get it to be really seamless, and then also blend with a nice color, and really just using one shade of composite, which certainly makes for simplicity, and I think, you know, saving on some materials in your operatory, and just trying to keep the technique rather simple. So I'm just going to put just a little bit more anatomy in it, because I like to put anatomy in my restorations, but at this point really the restoration is done. So I've used the bullet-shaped red stripe diamond to get kind of primary anatomy, and then I go in with the ET, a red stripe carbide burr, and really kind of carve out the anatomy just a little bit more. And then I just go in with a nice little final polish with this Oclu brush from Kerr. And you can lean on it. You can lean on it a little bit, but I wouldn't really per se lean on it. It's better to really just kind of kiss the surface of the tooth and let it really just do its nice shine and bring a nice luster to this material. So this material, you can see, it really doesn't take much to finish, and this will be a nice luster on here. And this luster, now, you know, the material hasn't been out real long, so can I tell you definitively it's going to last 20 years of beautiful luster? Well, no material luster is that long anyways. It should be a nice luster, so 3-5 years easily on these. And certainly this restoration, there's no reason you shouldn't get 15 plus years out of this restoration, to be very honest with you, with this size of this restoration. So I'm just kissing the tooth, if you will, just lightly. Matthew, just a little bigger for me. Okay. So there, hopefully you can see just a nice luster on that, and it really matches blends in nicely with the natural dentition there and with the adjacent teeth. So, you know, I think we have a very, very nice acceptable restoration. As I said, I would expect this really, you know, I've seen Herculite last 15 plus years in my practice, right? And filling this with some nanofillers, we're certainly, the research says that we should be seeing a little better polish, a little better maintenance of the polish, and hopefully a little better strength. So, you know, we don't have any great long-term data on the material, but certainly there's no reason that we shouldn't see good promise with this, and like I said, see a good 15-year result with something that size. So hopefully you've seen really kind of how simple this procedure was. I have really used Herculite since the mid-80s, and so Herculite really has a proven technology of 25 years, and they've really tried to, with the Herculite Ultra, simplify it so we have less shades. Herculite XRV has 30 plus shades. Now we're looking at a system that really only has 10, and hopefully only having to put one shade in here makes that simpler for all of us. And then on this proven technology of really Herculite, as I said, we should probably be seeing these restorations easily lasting 15 years or so.